Hello, I'm Nancy Carney, Community Relations Nurse for Middlesex-East, Visiting Nurse and Visiting Nurse Hospice. Our topic today is baby boomers, the sandwich generation. Are we prepared? Who are the sandwich generation? All those of us born between the years of 1946 to 1965. We are turning 47 to 65 years old this year. What kind of issues are we facing? All kinds of issues. We are nearly 70 million people who find ourselves sandwiched between caring for aging parents and raising our own children, and some of us have the complication of having a fourth generation in our home as well that we have needs to meet. Add in working full-time, trying to save for our own retirements, and the responsibilities can seem endless. What myself and our panel today are going to try and help you do is try and help you plan. It doesn't have to be as complicated as it seems. There are many resources out there, and we're going to try and help you navigate through that system. Who I have with me today on our panel are Karen and Mary, who have both experienced difficult times with an aging parent themselves. They're going to each tell us their stories. I also have with me Celeste Ricky Trahan. She's a licensed social worker as well as a professional geriatric care manager. And she's going to help us navigate through this system so that we can try and solve some of the issues that our panel and I'm sure many of you out there are facing right now. So we're going to start today, we're going to actually start with Karen's story. Karen's going to tell us something that has occurred with her mom. And Karen, why don't you start with your story about Mom?
Well, Nancy, caring for Mom actually started for us around the age of 65 when my dad died suddenly and she was left alone. At the time she was living alone, she was very independent. She actually went back and got a little job, driving, really doing very well. Several years later, at the age of 73, she was diagnosed with an end-stage lung disease that caused her to become dependent on oxygen. So oxygen became part of all of our lives. The children, the grandchildren, friends, sisters, people that she was exposed to every day. So everyone learned how to take care of oxygen. We processed the problems of going through holiday experiences, summer experiences, making sure deliveries were made, making sure she had the things she needed to actually enjoy her time. Oxygen bills, insurance questions. So that was our first challenge with Mom, you know, as she started to age.
So you had to deal with an oxygen vendor, so
Yes.
There were tanks and all this stuff. How was your experience with the oxygen vendor?
Our oxygen vendor was fantastic. It was a referral that was made to us directly from the hospital that she was in at the time. They were actually great. She befriended her driver and he was so good to her. She never went without. They never gave us a problem about going to multiple houses for holidays in summer. So that was a great experience for us. Yeah. They were great.
That's really important. That took the stress out of an overwhelming situation with the oxygen everywhere Mom went for all of you.
Exactly.
Well, in your opinion, what would you say with Mom's experience impacted the most on you and your family and your sisters and brothers and their families and your mom?
What really was the most impact at that point was eventually Mom did well. She got out quite a bit. She continued to drive, continued to socialize, had a lot of friends and liked to go out. At one point we did have to stop her from driving. And I think in looking back at the situation, that was the biggest challenge and probably the thing that upset her the most. Then we had to take over all the responsibilities of taking her to shopping, taking her to doctor's appointments, taking her to church, which she loved to go to every week, the hairdresser, visiting friends and family, doing all that kind of stuff. Her friends and her sisters were great, but they were not quite as comfortable with the oxygen and taking her around with it. So really it became a responsibility of the family at that point. She was maintaining a two-family home and you know, there was a lot of additional experiences to that. That became our responsibility at the time. So it really caused us to be out of our own families a lot. We would go up and visit her on weekends in the evening, try to do some house cleaning and things for her. So when you went up to visit and do things, it was a long day. She got very lonely and really liked us to come and spend a lot of time with her. So that became difficult towards the end.
Oh, I can imagine. How did you and your siblings kind of, you know, pull things together and deal with all of that? It must have been a lot.
We were very fortunate. There are 5 children in the family and everyone was completely committed to helping Mom. So we did a schedule and everybody would follow the schedule and we would try to accommodate different people's family obligations that they had and work around that. So we were very fortunate, you know, in the fact that there was many of us to go around and that we were all willing to help her out. We checked in with her frequently. Once in a while we would call up and she maybe didn't answer the phone or perhaps she had fallen asleep. Whenever we couldn't really get in touch with her, that really got, you know, became very nerve-wracking for us. So then we worried about her all the time. Shortly after that, she became diagnosed with an inoperable heart disease, which complicated her chronic illness because she couldn't have the surgery because of her lung disease. So at that point, we had to make some decisions about what she was going to do. So the first thing we did was we actually ordered her a lifeline. She was panicking all the time. She was calling 911. She was going to the hospital. The visiting nurses would come after she had had a hospitalization. They were very good to make us referrals. They stayed in as long as they could, but they were short term. They were only in for probably a month or so, and then she would be discharged. So we did get her some the lifeline operation, which was fantastic. That prevented her from calling 911 and scooting off to the hospital all the time, when it was really mostly anxiety that was sending her out.
Yeah. The lifeline can be, huge help for lots of families as well. So it's a really important resource to be able to access when the time is right. What other kind of things did you do to try and supplement, when you found that Mom needed additional services?
One thing that we did do at that point when the visiting nurses were finished and Mom was still wanting to be in her own home was to hire some private help. So we did employ an agency. We had asked around, got some numbers from the visiting nurses and whatnot, and we did hire a private agency. We actually talked to two and chose one, and honestly the experience didn't turn out to be as positive as we had hoped. Mom didn't want the help. She was doing it for us. The people would come, she would let them go home early without telling anybody. Very often she just didn't want them there at all. She would have preferred to have us. So the private care experience didn't go well for us. And some of the care issues that we dealt with around the private care, we were not that happy with the company, unfortunately.
Yeah. What other resources did you kind of look at? Did you look at any other, facilities or places like that?
We did. We actually looked at assisted livings. And again, we took Mom to many assisted livings. We toured some in the area, some close to her home, closer to our home. We were not in where she lived. We were 20 to 25 minutes on the North Shore. So we took her out to a bunch of assisted livings. She definitely appeased us with that, but it was never her choice. We were fortunate she had the resources to do it if she wanted to, but at that point she just wasn't ready. She was pretty insistent that she was going to stay in her own home.
Did you ever have the opportunity after a hospitalization? Did they offer a skilled nursing facility, which would be some time in between her coming from the hospital to home?
The last hospitalization that she had, and she had had 6 in the last 6 months of her life, so she had quite a few. We actually did push the primary care physician for some answers because we knew we couldn't just take her back home again. She wasn't lasting long enough at home and going right back in. He wasn't as helpful as we would have liked him to be. He kind of was leaving it in our hands to try to figure out the options. So we did press case management at the hospital. We did ask them if they could consider some long-term care facilities or skilled nursing facilities, at least bring her there. It seemed at the time that what she really wanted was someone with her 24 hours a day. She was afraid, she didn't want to be alone. She really enjoyed that climate. Her mother had actually been in a nursing home at the end of her life, and Mom was very comfortable with that. So we did actually put her in a skilled nursing facility after her last admission in the hospital last summer. And again, that experience ended up being a little bit, it was not a good experience for us. Mom wanted to leave right after being there for a week. She was insistent on leaving. There were some issues that she just wasn't comfortable over there. So the skilled nursing facility, we were hoping she would like it and she would stay there because we thought we could turn it into some kind of a long-term care benefit for her. But it just didn't work out. So now here we are back at square one. We do have a family member who's pretty involved in hospice and understands end-of-life care and kind of where that can be provided. Mom had made the decision to be a do not resuscitate. She did not want to go back to the hospital anymore. She was clearly talking about wanting to be comfortable. She didn't want to go to someone's home. She probably would have preferred to have been taken care of by us in her own home, which was really nothing that we could do at the time. So we were informed about the Sawtell Family Hospice House in Reading. And we had the fortune to get a bed there because they're not open all that often. Mom went over there and she lived there for 4 months, and it was a wonderful experience. She loved it. The people were so good to her. It was the 24/7 care that she needed. We visited all the time, but we visited when we could. Again, the schedule got made, and people went when they felt good about going. Very homey. The kids could be there. She had 10 grandchildren, and they all visited her regularly, and it was the greatest thing for us, and it was where she could have a very dignified 4 months, and she died with all of us around her, so it was very positive. We were very happy to have that.
Oh, that's
Yeah.
That sounds
So that's
like a difficult time, but
It
clearly
was. Yep.
with an ending that was positive.
Right.
But a lot of difficulties, you know, kind
Right.
of trying to rummage through all of the care that's out there and trying to find a fit in something that works well for Mom.
Right.
And was your physician helpful at all when you thought that hospice was right for your mom? Was the physician on board? Did he, you know, did he think it was right for her as well?
I did pose hospice to her physician at one point, and he felt she wasn't ready, felt that it wasn't something that we should talk about at that point. He had been her physician for over 50 years, and I think he had a little attachment to her too. I don't know if he was worried about losing her. I don't know if they go through some of that, but he was just not interested in talking about it at all. So we did find a physician that was able to see Mom and assess her, and agreed that with her decisions not to go back to the hospital, not to want to be resuscitated, and the complications of her chronic illnesses, that she would be very appropriate. So we were fortunate to find her.
Oh, well, that's good. You know, one of the difficult things is so many physicians and the public are misinformed about hospice and about the hospice benefit. And unfortunately, so many people are referred too late to hospice. So many people don't get to access their hospice benefit through their insurance. And clearly, what actually is the case is that people are appropriate for their hospice benefit to access that when they have a prognosis of 6 months or less, given the disease taking its natural course, of course. And they clearly do not want to be hospitalized again. They want to remain at home. The goals of care are no longer curative. They're really focused on comfort. And that's really what makes people appropriate for hospice. They don't have to be at that stage. You know, your mom wasn't at the very, very end when she accessed hospice, but it was appropriate for her. So we really, it's unfortunate that some physicians and many of the public are not really informed about, you know, when people really are appropriate for hospice and can access that and gain some of the good things that it has to offer. So Karen's experience kind of went from the very start to the very end, Celeste, and some things went right and some things went wrong. Why don't we talk a little bit with the professional about what kind of things could have avoided some of those pitfalls that Karen and her family unfortunately went through. The first thing we talk about is when you're choosing a facility, you know, whether it, when we start with a skilled nursing facility. So when you're going to choose a skilled nursing facility, what's the best way to navigate that system?
Well, Nancy, that's a very, very good question. When people talk about a skilled nursing facility or an extended care facility or a nursing home or a rehab, we're really all talking about the same type of facility, which can provide either short-term, long-term, or respite care. And they provide 24-hour nursing care, custodial care, and are reimbursed either through insurance, VA benefits, Medicaid, or private payment. So having said that, what I would always recommend to people is to try to get out there and tour facilities as early as possible in the process. Even if it's not going to be the optimal plan of care, even if the family members are not really looking at that to be the ultimate plan of care. What this avoids is the emotion. It takes the emotion out of the touring. It also helps people realize what they might like in a facility as well as what they might not like in a facility. And it really is very, very important for people to do that at a non-emotional level so they can be an educated consumer. When you're looking at facilities like that, I would also say that even though people are looking at location as the most important thing, it should not always be the most important thing. There are many, many quality facilities that are lesser known, that might be outside your comfort level of territory, that people should be open, family members should be open to look at. Also considering even a short-term placement. Short-term placements can provide respite for the caregiver. They can also buy time for families to make a longer-term decision. So accessing a facility, even if it's just for the short term, can also be a benefit to families as they're navigating through the decision-making process. I know when we talk about facilities, we're also talking about assisted living facilities. Certainly Karen looked at that. Her mom wasn't real keen on that. Assisted living facilities can also be considered a short-term option. I'm not sure folks really always know that. Right. Many facilities will offer a monthly test drive, if you will, to kind of look at facilities as a possibility in the future while the decision making is in process. The ways to actually learn about these facilities also in the beginning, one can go through a hospital discharge planner. Word of mouth is actually very, very effective. Social workers, discharge planners, and geriatric care managers can also be accessed for this information. They are the professionals. They can provide you with lists, but they can't always provide you with specific recommendations. So it is important to tour. And two very good online resources that one could look at least, in this area, would be through the state of Massachusetts, ehs.state.mass.us/nursehome, and also medicare.gov/nursinghomecompare are two very, very good sites that can help families sort of navigate through that whole process a little bit better.
Excellent information. Now, Karen also tried private help. That can be difficult as well. Why don't you help the people figure out how to hire private help?
Another good question. Private care is also a very challenging resource to be able to navigate through. It isn't that much different than facilities. Again, a place to start is to acquire a very good list of area agencies as just a place to start from either a social worker, discharge planner, or geriatric care manager. And the important piece to accessing private care, if there is time available, is to be able to interview ahead of time and offer as much information to the agency that you're looking at about your loved one. Anything about the medical, the physical, the personal preferences, and any personal biases are always very, very important to be able to inform the agency about up front, because that ensures really the best possible match of someone. So you're interviewing and you're going through the process. Another thing you might want to do is ask very, very specific questions to the agency about their pricing structure. Is there a minimum amount of hours required for their caregiver? Some of them have, 2 to 3. Other ones, may look at up to 6 hours a day that you're required to have a caregiver in order to have that particular agency. So you do want to ask those questions. You also want to ask, can the caregivers medicate? And if they can medicate, what are the parameters around that? Are there different rates for weekends, for evenings, and what is their pricing structure? So you want to have all that information up front as you're interviewing. You also want to familiarize yourself with the terminology that's going to be thrown around. Everyone doesn't always know what the term home health aide, certified nurse's aide, personal care attendant might mean. But you do want to familiarize yourself with those terms and be able to know exactly what role they can perform when they are in your home. You also want to be able to tell the agency what your expectations are in terms of a caregiver. Is there going to be housekeeping involved? Do they also need to provide some grocery shopping, some meal preparation, transportation, errands? These are all things that, in talking with your family, or if you're the only one making that decision, you sort of need to know these things up front or talk them over with a professional so you can get some guidance. So as you're interviewing, you know exactly what you're looking for. And in Karen's case, Karen's mom did have the financial resources to be able to provide this type of care, but this can be difficult for families who do not have this type of financial means. So other ways that they can be reimbursed could be through a long-term care policy, could be through veterans benefits, or it could also be through elder services, as I'll talk with Mary about later. And the final thing I want to say also about private care is that Karen did have some difficult experiences with the agency that she was involved with. No family has to feel locked in to that particular agency. If there is difficulty with the caregiver or the caregiver becomes unacceptable, families should always feel that they can ask for an alternate caregiver or that they can actually move on to another agency without repercussions. So that's what I would say about that.
Yeah, that's great information.
Very helpful, yeah.
Yeah. I think probably we're going to move on to Mary's story, where we're going to, kind of face a lot of other issues. And I think that everyone's going to find that Mary's story is probably a very, very familiar story to a lot of people out there. So Mary, why don't you start your story, also about Mom?
Yep. My mother is 86 years old right now, and in 1995, my husband and my 2 children moved back to the house that I grew up in, and my parents built an in-law addition. In 1998, unfortunately, my father passed away, and it was a very hard time for my mother. She was diagnosed with depression.
Oh, that must have been really difficult. When did she first start showing signs of dementia?
She started showing signs of dementia. It was pretty mild at first, but right immediately after Dad died, I started noticing these signs. And in the last, 13 years, it's gotten pretty bad.
Oh, gosh. How has the changes that you've seen in Mom, the advancing of her dementia, how has that impacted her independence?
Well, it's impacted greatly. She can no longer drive, or we kind of forbid her to drive. She doesn't shop for herself anymore. She doesn't go out. She's not independent that way. She is able to live in the in-law apartment by herself and fix her meals and wash herself and wash her clothes and take care of her house as much as she can. But driving is a big hindrance on her independence.
What was her life like before? Prior to this impacting her, what was her normal days and weeks like?
Oh, she loved to shop. She loved to go to bingo like 3-4 times a week at night. She would drive my kids to their afternoon activities if I needed them. She was there. She was very independent.
So this change in Mom must have had a huge impact on you, your children, your husband, your whole family.
Exactly. It really has. We have to worry about her all the time, and she's always asking for her keys, and I had to take them away. And, her doctor said to me, she said, with my mom, she's like, "You can hold the keys, Mary," and then to my mother, she said, "But you can hold the license." So that kind of worked in, it was a deal that my mom accepted.
So that helped somewhat, a little.
Right.
But
exactly.
That's similar to Karen's story. It sounds like taking the keys away is one of the biggest issues that faces seniors, no matter whether it's from dementia or from illness. It totally changes the whole situation for not only the person, the individual, but for the family.
I agree.
Because it puts the biggest impact. So what kind of things did you then kind of have to put in place once Mom was no longer able to drive herself?
Well, I had to take over all her shopping and I would take her to the errands. She doesn't leave the house now unless she's with a family member. I've had to do her medications. I had to go to the pharmacy for her. I had to refill them. I had to make sure that she's taking the right meds, etc.
Medications is a big thing. We know as being a nurse that medication is probably the biggest thing, and people that are facing a loved one who's having memory issues, forgetfulness issues, that must have been a huge impact with Mom and medications. Was that something that you feel was something that worried you very much?
Absolutely. As her disease progressed, I could watch her fill her weekly cassette. But then she was unable to fill them, so I filled the weekly. And then as it progressed, she forgot that she took her pills that day, so she would take Thursday's pills, so now I just give her a daily dose of pills and remind her to take her evening ones. So it's you can see that progression.
That's really hard. As visiting nurses, that's a big problem that we see with patients with dementia for families. Is the pills. Patients that take a week's worth in one day, or like you said, Mom taking Thursday's pills on Wednesday, forgetting if she took Wednesdays. But and the pill cassettes I'm sure are helpful, but now you got to the point where you had to do it individually.
Correct.
That must have put a huge burden on you, though. That means you have to be present, bring the pills there for the morning, bring the pills there for the evening.
Right.
So, with the memory issues, what other kind of tasks have you had to, make adjustments to and provide for Mom?
Well, I've taken over her finances. Unfortunately, she doesn't know how to write a check anymore. She forgot.
Oh.
I've done her shopping. you know, cleaning, meal preparation, you know, basically, she's, you know, she's able to live alone in an in-law apartment, but, you know, I feel that she's lonely and, you know, there's not a lot of interaction.
Yeah. Oh, that's tough. And so you need to, she's able to provide herself with something like a breakfast or things like that. She can make little meals.
Right.
Does she eat? Does she, I mean, how do you even know?
Well, I kind of, I know that she eats breakfast because I've been there on the weekends and stuff, and I see that happening. But lunch is very iffy, and, you know, drinking, she never, ever has a glass of water. So every time I interact with her in her apartment, I give her a glass of water. I remind her to eat. If I ask her what she ate, she can't tell me, or if she did eat. So definitely dinner is always on my family and I.
Oh, gosh.
Which I don't mind, but it's something that needs to be done.
Yeah. Oh. In terms of her behavior, what other type things have changed in terms of her general behavior?
Well, she's very repetitive. The same question over and over, even if it's 1, 2, 5 minutes apart, you know, she doesn't remember that she's asked. Unfortunately, she asks for family members who have passed away. Sometimes I find her with her phone in her lap, and I said, "Mama, who are you calling?" She's like, "My mother." And I'm like, "Oh." I'm like, "What number are you dialing?" And she repeats her number, which, you know, that's great because I don't want her to call some random stranger continuously. So things like that.
She calls herself.
Yeah, and she gets a busy signal, so it's really good.
That's good. Well, that probably satisfies her anyway.
Exactly.
Oh, Mom's not home.
Busy again.
Yeah. It's good that you can look at some of the aspects with some, you have to look at, you must have to use humor, because otherwise you probably would go crazy. Right. Oh, goodness. Well, I'm sure this must have an impact on your whole family. How has it impacted your husband? I know you have a husband and children.
2 daughters, yes. Well, they're a huge help with me, and they're very supportive of me. You know, it's kind of come full circle where Mom used to watch my daughters, and now my daughters help me watch my mom. Yeah. My husband prepares dinner almost every evening because that allows me to go out and have some exercise or, you know, stress relief and
something for your mental health.
It's just, yes, exactly. You know, we have adapted.
Yeah. I think that's a big thing for everyone to think about, is themselves and providing themselves with some type of divergence and sometimes pleasurable things to do for yourself, just to keep yourself sane while you're doing that. How about the physician? How has your physician been in terms of helping you navigate through this whole process with the changes in Mom?
Well, my mother's physician is great. She's actually gone through a similar experience. Her mother was 90 the last time I spoke with her, and she had just recently placed her in a nursing home. And she was living in an in-law apartment with my mother's physician and her husband. So she's very sympathetic, and she came up with the deal, you know, the keys. You know, Mom keeps the license and I keep the keys. So
maybe because she'd been through it herself, she was able to help you. So that's important, to have a physician who can give you some ideas on ways to kind of navigate through the behavioral changes and things like that. Well, Celeste, I think Mary's story is pretty common.
Very common.
You know, especially with our elders are living much, much longer. And that's part of the problem for us baby boomers, is that our parents are living longer, which is wonderful. But it also brings with it, you know, forgetfulness, memory issues, perhaps dementia or Alzheimer's type dementia, chronic illnesses that people are living with, heart disease and cardiac disease, Parkinson's disease. You know, all of these illnesses that as we age and live longer become progressively more debilitating. So Mary, it sounds like you and your family have done yeoman's work, trying to kind of, you know, pull it all together and doing it all yourselves. And that's a big responsibility. Have you kind of been thinking about, you know, any other type of, you know, private help to supplement what you're doing, to ease the burden a little, or you know?
Yeah, we have been thinking about it. My siblings and I have talked about it often, but, you know, taking that last step makes it real. You know, so, you know, that's why I hesitate. But you know, she would be happier if she had some company, but, you know, like Celeste was talking about the personal biases, she doesn't want anybody in her house. You know, she doesn't want strangers in her house. So, you know, it's a delicate situation.
So Mary's just starting the process, and I know there are a lot of options out there, so take it away, Celeste. I know. I want you to start with Mary. You're going to be starting from the very beginning.
Yeah, Mary's story is very common and becoming more common. And you had alluded to the fact that people are living longer, and so we also are looking at baby boomers as well as older caregivers.
Right.
We're also looking at that as a multi-generational impact. Her children will have, you know, an interest and a participation in this. So it can be a multi-generational type of caregiving situation that we're looking at, which is, you know, changing all the time. So a place I would start for Mary or for anyone just beginning this process would be to start with an organization called Elder Services. Now, each town in Massachusetts is part of a catchment area under the Executive Office on Elder Affairs. And what they do is to provide services such as personal care, homemaking, bill paying, transportation, grocery shopping, Meals on Wheels, senior dining sites, a Shine program, which actually is a volunteer program of someone to come in and evaluate what insurances you have and give you some advice in going forward with that, respite care, caregiver support in the home, and emergency response systems, which can also include electronic medication cassettes. Which is something pretty new over the last couple of years. So in order to start with Elder Services, one needs to have an evaluation. You can either self-refer, or if you're working with an agency, you can have the social worker or the discharge planner or the geriatric care manager make that referral. And in order to be approved for that, what you would need is a two-part referral, financial approval as well as physical approval for that. So once you call, you make the referral, and they'll ask you a few questions. If you sort of pass muster, if you will, you'll be able to go in. They'll be able to go in, evaluate your situation, and be able to create a service plan for you that you can either agree or not agree to for a small copay. Now, there's many, many subsidized programs under Elder Services despite the level of care that somebody needs in the home. And many times the state has become more and more attuned to the fact that they are trying to keep people that are even nursing home level in homes. So the programs, you know, can be many, many days. They can just be a couple of days depending on the needs in the home. So that would always be a place that I would start. In terms of navigating through. Another program that I would think about that unfortunately is not always as popular because it's a change in routine would be medical daycare. Medical day programs are situated all over. They are a program which typically run Monday through Friday, so the business week, 9 a.m. to 3 p.m., and they provide socialization and a change of scene for your mom or for your loved one, and they also provide respite care for you, a break, a place for them to go so that you know they're safe and you know they're cared for, and you can be wherever you need to be and know that they're okay. So the way that one would get there would be either you would transport them, or there are different modes of transportation. And just to do an aside on the driving issue, once you take away driving, one of the most important things is that you should replace it with a way for somebody to be transported, because it takes away the sting of the driving. So I would always think about perhaps maybe, you know, what is going on in the town that can provide different modes of transportation for your mother, like the Council on Aging or like the RIDE, to be able to offer an option so that the driving isn't so important to her anymore, or important to anyone going through this. The day programs offer snacks, breakfast, a meal, lunch, activities. You can bring medication to the day program. There is a nurse on site. There is a personal care attendant on site. So you know that they're getting medical attention, and they can actually get their medications right there if need be. And the reimbursement for these can be either through Medicaid, it can be through private means, or in some cases it can also be subsidized through the Elder Service Organization we spoke about earlier. Wow. So that's a really good place, I think, for either Mary or for anyone just beginning these issues to start.
Mm-hmm. And in general, you know, that would be great for Mary and for Karen and for anyone else out there in terms of navigating through the system? I know sometimes, as a VNA, we encounter this a lot, and the social worker for the VNA kind of initiates a lot of this as well. So obviously, clearly, if they're starting with VNA services,
a social worker would be the appropriate place to start with all of this.
Okay.
Sure.
What are some of the other things that you think are really important? I think sometimes we don't even realize, we might have all these problems with our parents, but if we, in the very beginning, I think some of the most important things that we need to do are get the facts and get the power. Celeste, will you talk a little bit about getting the power?
Absolutely, absolutely. To both Karen and Mary, if they had not done that, and I don't know that you had or hadn't, but in the beginning, the first thing I would have done is get my hands on somebody that would be able to provide the information that you need. A VNA social worker, a discharge planner, or an outside professional such as a geriatric care manager. I've alluded to that particular term a number of times. What geriatric care managers are independent contractors who are hired privately. In some cases, they can also be subsidized by a long-term care insurance policy. But basically, they are professionals that can be hired to navigate through this maze. How are we going to put this plan together? Where should we start? What should we do first? And those folks can actually facilitate a family meeting. They can be the outside professional that can be the problem solvers, the resources, or the mediators to kind of begin the process of getting you where you need to be. And a good website to find a care manager would be caremanager.org on the web.
Other things, when I mentioned getting the power, we all know the difficulties, especially those of us in the medical profession, with the HIPAA laws. Those are the privacy laws. And so often, I don't know how many people have encountered this. I know I did with my mom, trying to access information through her physician when she had a bout with an illness, was that the HIPAA laws prevent me from getting any information about her medical condition unless she had signed a healthcare proxy and I was the proxy. So I think that's could you address the healthcare proxy?
Oh, absolutely. Another very, very important piece to the beginning of this puzzle is accessing an elder law attorney. And I can't stress enough the importance of these particular professionals. They are specialized in estate planning and elder law. This is all they know. If they are part of an organization called the National Academy of Elder Law Attorneys, again, the website would be naela.org, NAELA. That is where you would find someone in your area. And why you might need someone like that is not only to assess the financial resources that you have, what do we have to work with here, what might we still be able to protect if you can, if we're looking at a facility placement down the line, but they can also be very, very integral in the process of drawing up a healthcare proxy, durable power of attorney, and one of the most important things that's coming and that should people be thinking about is advanced directives. Absolutely.
Yeah. If people have power of attorney, what kind of power does that give them?
Well, durable power of attorney can only take place when someone's capacity is taken away from them. So durable power of attorney would really be addressing environmental issues and financial issues only. The healthcare proxy typically addresses a person or persons that can step in if someone loses capacity to be able to make those very, very important healthcare decisions going forward.
Okay. What about just things like paying your parents' bills, doing their banking, things like that? Do you need to have power of attorney to be able to do your mom's banking or write her checks or pay her bills?
Depending on a bank, some banks will require that. Some banks will require more than that. It really depends upon the individual bank. There is also a resource out there where you can actually hire someone to pay your bills, a bill payer. So there are money managers out there as well that can actually take over that very, very complicated process of figuring out people's insurances, the insurance bills, what's paying what, and actually paying their bills for them to take that away from them if it's no longer appropriate that they do it themselves.
I've also encountered people who, when they're in the hospital, they've asked by social workers or whatever to start filling out all this paperwork. And I think the biggest piece of paperwork that they're asked to fill out is the Mass Health application. Now, being able to access and be qualified for Mass Health is a wonderful thing because people can get a lot more services at home for their loved one. But it's not the easiest form to fill out. Is that correct?
It can be very complicated for somebody just starting out, but an elder law attorney should, again, if there are many resources for the person to consider, that should be the first stop, and he can assist you in that Medicaid planning process and assist you with that application. For folks that do not have those resources that we were talking about, for people that don't need to worry about that, there are actually organizations that can help you fill out that application. You can also, once again, go back to a VNA social worker to do that. You can go back to your geriatric care manager. So there are resources, including elder services, that can also help you fill that out.
I know there's a program, the SHINE program, and I know that's a wonderful program. Could you address what the SHINE program actually can offer to people?
Sure. SHINE volunteers are wonderful, and each elder service organization offers a SHINE program. They are volunteers, typically people who have been in the money management field in the past, CPAs, or people, maybe they're former bankers or whatever, but they volunteer their services and they will actually sit with folks and kind of pick apart what their health insurance options are, can be, and what they are presently, and make some recommendations for them about how they can go forward. And that is all they do, so they know it very, very well.
And they volunteer.
And they
There's
volunteer.
not a cost for that.
There's not a cost for that.
Yeah, that's wonderful. Share some of your background and some of your information that you might have to offer to Karen in terms of hospice and in terms of end-of-life care and those type of options.
Okay. Certainly Karen's experience was hospice, and we do want to talk about that a little bit, because when people are looking at end-of-life planning options, it's important for folks to understand what the hospice philosophy is and the various places where it can be provided. Many people feel that it has to be in a facility, and many other people feel that it can only be provided in the home. It can be provided in a number of different environments. In Karen's mother's case, it was eventually provided in a hospice house, a residential hospice house, but hospice care can also be provided in a person's home with family or paid support. It can also be provided in a skilled nursing facility. It can also be provided in an assisted living or in an inpatient hospice house. And the types of services we can expect from a hospice organization would be skilled nursing, home health aid, which provide the personal care, the real hands-on care, social work services, chaplain, expressive therapy, which is a service that is offered for children, for support for children and grandchildren, and volunteer services. And it's all customized to determine, whatever the person might need.
And I know hospice also has bereavement care. Can you address bereavement? People don't realize bereavement is a very big part of the hospice program. What's bereavement for hospice?
Bereavement program, oftentimes after the person passes away, folks are very, very devastated, not only by the loss of the loved one, but they think that the hospice staff and everyone will just go away. If people are struggling in a particular way with the loss, and this can apply to anyone in the family, hospice will follow that family for a year afterwards, and it can take a number of different avenues of how we would follow somebody. What we would do is offer them, or any hospice would offer, a social work visit if somebody was of particular high risk in terms of their coping. There might be mailings to the person to kind of just, normalize their grief a bit. Many people get very comfort from the mail, a lot of comfort from the mailings. We might utilize volunteer phone calls. Volunteers might do some wellness checks, check in on people. And there are support groups. There's support groups everywhere. Depending on what a person might need or when they might need it, many hospices have a bereavement coordinator, and that information can be accessed through them as well.
And that is still covered under the hospice benefit?
Absolutely.
Not a charge to the patients. That's part of what hospice does.
Absolutely, absolutely.
To talk about a couple of other things I think that people can access as well. We're talking a little bit about hospice, but not everybody's ready for hospice, whether it's physically or emotionally. And there are some programs out there that some VNAs and hospices, I know that our VNA has palliative care programs run by the hospice team, which is a great resource when patients might need that kind of professional care that could be provided by the hospice team, but yet not quite ready for hospice. So there are, people can look to agencies and see if they might have palliative care programs such as the ones that we have to be able to provide as well.
Sure. Yes, Nancy, many do offer palliative care programs, and many times those programs are offered to offer support for someone having pain and symptom management issues in the home, perhaps some uncontrolled pain, or perhaps just people are not ready to hear that hospice word. For many people think that the hospice word is the end, or we're looking at death imminently.
Right.
So just taking the word hospice out of the equation, we're just looking at something called a symptom management program. We might be looking at a bridge program to just begin to introduce the support caregivers into the home, to begin to introduce that type of care, to kind of just take the pain out of it, if you will.
Well, are there any questions that you guys, talking about all these things, anything that popped up in your mind that you'd like to ask Celeste in addition to the information she's provided?
No, I don't think so. That was very helpful.
Yeah, lots of information, yeah.
Well, Mary, I hope we'll have some place for you to start, and wish you all the
absolutely.
luck with Mom.
Thank you.
And, we really empathize with your loss this year for you and your large family as well. I'm sure it's been a difficult year for you.
Thank you.
Going through all that. If there are any other topics that you find of interest, given all the information we talked about today, any of those could have their own show. Please contact us at 781-224-3399. That's Visiting Nurse of Middlesex-East and Visiting Nurse Hospice. You also can access our website, www.vnaofme.org. Thank you.